And again, this is part 3 of the trauma-informed suicide prevention, part 3, setting the stage, collaboration, and risk assessment. So during the last 3 weeks, we've had the pleasure of having the conversation with everybody here in the audience in regards to how to integrate a trauma-informed suicide prevention program. And so part 1, we talked about model policy specifically related to how to implement a suicide prevention policy related to California's AB Assembly Bill 2246. And we talked about how to integrate these components with the prevention, intervention, postvention. We talked specifically about setting a task force to help with the development of the policy. In part 2 last week, we talked about conversations in regards to trauma-informed practices related to training and then also effective campaigns. If you were not able to attend any of those trainings, they are available to access here as well on the link, and you can access the recording for those 2 webinars as well. In today's presentation, we welcome everybody back again, and we're not going to do a lot of review. We're going to talk more specifically about collaboration and risk assessment, which is the last component of a suicide prevention policy. And also, we want to let everybody know in the audience that for everybody that needs help, anyone that needs assistance, these particular websites are available 24/7, and there is help out there. This is our disclaimer related to the training, the webinar today. And again, this is all the wonderful map that delineates all of the different technology transfer centers here in the U.S. And what we do at the Pacific Southwest, the MHTTC, we offer collaborative, innovative trainings and technical assistance and resource dissemination. It's really to provide evidence-based practices, resources for practitioners so that they can strengthen resources effectively within their communities. And these are some of the services available. We have no-cost training, technical assistance, and resources available. Okay, we have some additional upcoming distance learning opportunities. As we're looking at, this information is actually on your slides as well. So if you're interested in participating in any of the upcoming learning opportunities, you can click on each of the registration links, and it will take you directly to the registration and more information about the upcoming learning opportunities. There's some additional distance learning opportunities as well. And again, if you have missed any of the previous webinars, you can actually click the link, and you can actually access any of the webinar recordings available here. You will receive a certificate of completion. Again, when you finish this particular webinar, there will be a link that's going to be connected to your email, and you're also going to be receiving continuing education hours as well, and there's going to be information and instructions related to that. This piece. So now that we get that out of the way, so today's presenters, in the last 3 webinars, the team here, Tina, Heidi, and I have been speaking to you about integrating trauma-informed practices and suicide prevention policies. Again, the 3 of us have a combined experience of 20 years plus in developing school mental health resources, integration of suicide prevention policies at a variety of different positions. We all have administrative credentials as well, and we've been able to work within the communities to integrate some of these wonderful opportunities that we're going to talk to you about today. So you're in good hands. Today's agenda, we're not going to specifically talk about how to conduct a risk assessment. Pacific Southwest MHTTC has a wonderful library of different recordings and past trainings that really talk specifically about how to conduct a risk assessment. What we're going to be addressing today is the effective components of a risk assessment. We're going to talk about how to integrate some of these risk assessments and integrating the high-risk population. The other piece that we're going to talk about is the duty for schools to provide a comprehensive suicide prevention risk assessment and the liability related to that. We're also going to talk about collaboration and the effective pieces in relation to providing a continuous trauma-informed suicide prevention program and also sustainability as well. The other component that we're going to talk about is an effective reentry plan. And the last piece also is talking about post-prevention services and integrating and building a crisis response team. Throughout the last 3 series, we've talked about the components in relation. Go back to one slide. There we go. So the objectives in regards to the trauma-informed prevention policy that we've been talking about is really to integrate the to talk about the traumatic experience and stress related to suicide, also understanding the role of school leaders in providing trauma-informed support services, and really how to collaborate and integrate some of these pieces and creating that buy-in for our school staff as well in all of these effective programs. So as we're thinking about trauma-informed practices, one of the things that we want you to think about in today's session is how do we integrate a trauma-informed support system for students that are at risk for suicide once they actually have been identified. The next piece that we want you to look at is there is a video that we want you to see. I know with Adobe Connect, we're not able to show you the information here. What we're going to do is we want you to click the link on the particular website here, YouTube, and it's about a 3-minute video that we want you to look at. So as you're thinking about some of the integrations of trauma-informed practices, we want you to think about those pieces, and then we'll come back in about 3 minutes to go over your reactions in regards to the video. Great. So I know that you recognize the actors in that particular video, and one of the things I watched the entire series. I don't know how many of you have watched the series here, but 13 Reasons Why was, it's just information about background information, was about a student that died by suicide and created some videotapes to really talk about like the reasons why she died by suicide. So in this particular scene, we are thinking about trauma-informed practices. And so as you were reviewing this particular video, where did go wrong as we're thinking about trauma-informed practices and risk assessment? Everywhere. Can you be specific, Julian, in any of the areas? It was an interrogation, right? Lack of empathy, compassion, leading questions, more specifically. He didn't even ask if she was okay, right? Shaming, we talked about the victimization, right? Twice, blaming. A lot of times, we introduce like a video of what to do, right? So these are, kind of an introduction of what not to do in a situation when the student comes to you that's at risk for suicide. And somebody in the chat talked about, like, this is the reason why a lot of students don't come forward, because of the way that we're, just the environment that they're presented with, right? And just in the tone, just his interaction with her, she was definitely crying out for help, and then there was no empathy, connected to it, right? In the applied assist training, it's one of the evidence-based trainings that you do, is we talk about invitations. So there was that lack of invitation for her. Hannah really just didn't feel connected, right? She didn't give her, exactly, Belia, did not give her a safe space to open up and have a conversation about what she was struggling with. And so as you're thinking about a trauma-informed practice or even just interview, how do students wind up in your office? Because it kind of starts from there as well. Like how are we training all of our teachers or our eyes and ears, who's the custodians? How do we train the individuals so they can have a friendly opportunity to talk to a student that's at risk for suicide or is having some mental health concerns, right? So it's something to really kind of think about, right? It's how does the student get to you, to the assessor who's going to provide that risk assessment, and also once they're in your office, thinking about what are you obligated to do if you suspect that a student is suicidal. Never called family services, right? Never contacted parents. So what's the obligation? We know that there's, a legal mandate that we have to do, right, to be able to support the student. The other piece too is what sort of relationship do you have with your students? I know that a lot of times we're very busy, we have really high caseloads, and sometimes we just kind of tend to do things really fast. So it's really about creating that relationship with your students. Whenever there's a student that comes, to talk to you, or even at this point right now, distance learning is so hard to really engage students at this moment because some students are not participating in distance learning. It's hard to connect with them as well. And so all of these conversations we're going to have about today. And the last piece too is how important is it to build rapport with your students, right? And it's really, really important to make sure that there is a connection, that there's a safe space, that environment where kids can actually come to you, even adults, right? So we're going to talk a little bit about statistics, but we know that there's an increase in suicide between the ages of 16 and 24. We talked about that in the last couple of webinars, and also between the ages of 35 and 55. That's a lot of our staff members, right, that could potentially be at risk for suicide. And we're also, continuously looking at how the pandemic and all of the other pieces and political issues that are going on as well, how that really has increased our anxiety and depression overall as well. So it's really about, this conversation on the video is about not what to do, but also just kind of thinking about just kind of setting the stage today about how important it is to really have a conversation in creating a trauma-informed space for your students to come in and really talk to you about what they're dealing with. So as we're looking at trauma-informed practices and risk assessment and collaboration, one of the pieces of the model policy, and again, I know there's people in the audience from a lot of areas in the country. We're specifically talking about AB 2246, which is California law. But one of the pieces that we're going to focus on today is about the scope of practice, right? So one of the pieces that the model policy talks about is that you must act within the authorization and scope of practice of your credential or license. We're thinking that, this particular piece is really important because we want to make sure that there is the right assessor. We'll talk a little bit more about that later on. But it's important not only to just have the right people that are identified to conduct these assessments as well, but also is knowing that there's training that's involved for these particular assessors. So there's this specialized staff training for school counselors, psychologists, social workers, and nurses that are within your campus. All right, next slide here. So again, we're not going to specifically talk about how to conduct a risk assessment, but these are some of the really important components of a risk assessment in a school setting. We want to make sure that every warning sign or threat is taken seriously, right? So we have students that have identified information, and I know that when I was a school-based social worker, we used to get notes in our inboxes or our mailboxes, right, of a referral or an email, and then we weren't able to access that information the next day. And I think even now, there's specific issues connected to distance learning, and how do we make those pieces, make those connections right away, or taking that immediate action right away. Again, not leaving the student alone. And so we'll talk a little bit more later. And actually, the webinar number 2, we talked about distance learning assessments and the referral process as well. But it's making sure that somebody has that connection with that individual right away. And also conducting a risk assessment by a trained school district employee, making sure that there's a protocol during school hours and then also during distance learning time, and also determining the protocol after school hours. So we, in the past couple of years, we're actually in the previous school district where I worked, there was an increase in students access or connecting to individuals past school hours because there's sports going on, and also like during the weekend there's different school activities. So it's really making sure that there is a protocol in place for how to really support the students once they're after school hours as well. Once the risk assessment, once the student is actually in the office or in virtual environment, determining the level of risk, determining whether there's a low, moderate, or high risk. Also making sure that there is a process for gently informing parents about the risk assessment. The other piece too is making sure that there's a process for means restriction. Making sure that there is an elimination of the means of how the individual is going to die by suicide, what the plan looks like as well. Again, the last piece that we're going to talk about is how to follow up and refer. Ensuring, I know in the last session there was a question about, how do we connect these students that are not being able to access those resources, and we'll talk more specifically about that later on. And the final piece that we're going to talk about is, talking about the reentry process as well. That's important to connect to. Heidi?
Thanks, Angela. So this slide in particular is an example of what we call an identity support plan, and it is for our transgender students who are in transition. It also might be used for students who are gender fluid, who are in a kind of a questioning place as far as their identity. This is an example of a trauma-informed strategy. The idea here is to collaborate, and that is the focus of this third session. We're not only collaborating with each other as professionals, but we need to collaborate with our clients, our students. So students who self-report that they are in transition or they would like name changes in the student database, that type of thing, are usually referred to our school counselors and our LGBT advocate, or someone who is comfortable and great with this community, connected with this community. And what they do is they go through what we could consider an identity support plan. Now, the purpose here is so that when the student comes to school, they have a day full of dignity, of support, of validity, that their identity is valid, that they don't have to remind someone every 5 minutes, that's not my name, that's not my gender, that's not what I go by. Can you imagine how frustrating life would be if you never felt you were seen, heard, or even respected as a valid identity? And so what happens is, even if teachers are open and willing to support the transition, many of the computer software, like if you have Google Classroom or sometimes even the electronics used for the lunch ID, don't convert. And so there are different systems now that will convert student databases for a temporary ID so that you're not usurping the law that says you can't change name without a federal order. But you can do a temporary conversion so that that student can live under that identity full time. I.e., for example, if a sub shows up one day, that sub would know that that student is their preferred identity and not know anything else about their background. So again, that student can live that preferred life with respect and feel safe in that role. So on the next slide, we're going to show you an example of some of the questions that are in the interview sheet. It's a 3-page packet, and we don't necessarily answer all the questions because most importantly, it's about starting where the student is. And many students are just at a place where I just want someone to call me by a different name or different pronouns. Some students are prepared for full transition, and they would like to participate in extracurricular activities. They would like even a diploma with their preferred name. So you have students at all different places on the spectrum. So you go through this interview sheet just to figure out where are they, what can we do as a school district, as a school counselor, or even a social worker to support them through the process. Here you can see we are asking the very critical questions about parent-guardian involvement. Of course, we need to know, are the parents supportive? Are they involved? Because we want to be sure that we're not the folks who end up disclosing this if, in fact, the student hasn't shared. So there are many different types of identity support plans available on the web. Sometimes they're called gender spectrum plans. But again, this is really about connecting that support staff member with a student who has this very unique need and needs to feel that there's someone who can hear them, that they're being validated and supported as they move forward with their experience.
Okay. As far as the last couple of webinars, as well as our tools that we've been sharing, the hope is that that you're hearing clear guidance, that we are using some common threads or common points here in all of these tools to ensure that we're supporting students. So we absolutely want to make sure that we are not tiptoeing, that we don't have time for that. We need to make sure that support is there for our students. So we ensure that we are letting our school community know, what can you do? These are the things. Reach out. If you or someone you care about is struggling, reach out. You just might be saving a life. We want to make sure that folks are taking action. We talked about doing that immediately. And so having that flow chart is absolutely, again, critical to connecting a student. Ask. Often we are afraid to ask straight out, but talking openly helps. We're trying to make it okay to ask the question, to use the terminology in and around suicide and suicidal ideation. The more that we can talk about it, the easier it becomes, and we hope will also reduce the stigma attached. Listen, just be there, showing up, being present. If you think your friend is in immediate danger, stay with them and get help. And then, of course, providing those resources for students and staff members as far as what needs to happen next. And then, of course, telling. Those reporting protocols are essential. And even if that student wants you to swear to secrecy, there's no betrayal in getting help. And we try to share that with students and staff, of course, that this is the safest option, is to tell, again, get help. And also, there are options for reporting anonymously. So having these as guidelines and, of course, following up with both tools, protocols, flow charts, and things to support it.
So the information that Tina just shared can be really helpful when you're training teachers and helping them understand their responsibilities. In all 3 sessions, we've talked about different strategies to get our educators to understand how their roles are pivotal to support and appropriate protocols being implemented. The lucky part for teachers and non-support staff is that really their only role is to report. And once they get that message is clear, they can use the strategies that Tina talked about, then we hope that they will step up to the plate. Unfortunately, for those who are still a little bit scared or discouraged, we might have to talk about other things such as liability is imminent. And that's a pretty strong phrase, but the reality is reporting is not about being correct or valid. It's about making appropriate reports when there are suspicions, red flags, and concerns. And we know as helpers that when those reports are not made, that again, that liability is very foreseeable. With suicide as well, there is no waiting period. And sometimes people get confused. Oh, with child abuse, I have 24 hours to get my written report in, or I have 36 hours, depending where you are. And so folks get a little confused, and so we have to clarify that there is no waiting period, that it's not appropriate to call the school counselor at 8 o'clock at night or the principal at 8 o'clock at night and say, oh, I had a concern about a student today at lunch. At that point, we've already potentially left that child in harm. Bottom line, professional and personal, their credentials at stake and their home is at stake, because even if for some reason they don't lose a credential for not reporting, that student still has the right to take them to court for damages, for monetary damages, so they can lose also their personal wealth. And again, we hope that people will do the right thing and step up because it's compelling, because we want to save lives. But this is sometimes a helpful reminder so that when they're feeling a little doubtful or feeling a little scared to take that step to make their report, they'll think about their home and their credential, and this will help them, kind of move forward a little bit. In addition, we want to think about what is the climate of the districts? Where are we? Most districts in different states have different types of student behavioral surveys, different climate surveys, perhaps the Healthy Kids survey. And it's important to monitor the numbers. Are suicides going up or ideations going up? Is self-harm going up? What are the trends and what are the needs so that the services can be on point and targeting what is the most critical so that resources are maximized for those services. Most importantly, what is the sense of safety? If students are in a very safe environment, physically in the sense that nothing dangerous has happened, but they don't feel safe internally, then academics are impacted and their emotional well-being is still being impacted. So it's about ensuring that that safety is at all levels. And the way to get there, of course, is through the training and talking to staff about how to be trauma-informed. Not asking what's wrong, but how did this happen to you? How did you get to this place? And Angela's given us lots of examples about that. When we look at different practices, you can see here we've listed things. Many of those we've already talked about in week 1 and 2, and many we're going to talk about today. But it's really helping educators know that it's not about everything being in its own binder or its own silo. It's about all of these things working together. And when the system works, our liability is covered. We're safe. It's not about being correct, like this was a good report, this was a bad report. It's about the fact that the appropriate reports were made. And I'm sure all of you are aware that when you make a report and there is no follow-up, or there appears to be no abuse, or the suicide risk was low, there is no fault in that. There's only fault in not checking to begin with, not being concerned with the suspicion. And that's the message that we have to get to our staff.
In these messages to staff, we want to make sure we're communicating the support to students. What else needs to be covered? And so we want to ensure that they are providing, or individuals do receive, the care they need based on the impact of previous experiences. If we are given that history, we are able to make better decisions, and that'll help guide our reentry process. So providing reentry support, which we'll clarify later and go into greater detail as far as what happens after the hospital. Also, whether we're talking about identity plan or whether we're talking about a safety plan, identifying a safe person for that individual student is what we need to ensure happens anytime we have a student of concern. Do we need a potential 504? Possibly even evaluation and or even an IEP. We want to ensure that we are, in our provision of support to students, taking a holistic approach, looking at the whole child. And that will include, and we keep talking about this, and Angela's going to share about trauma-informed practices, but the impact of trauma, whether we're talking about ACEs, adverse childhood experiences, or just even looking at, again, the curriculums, the different practices we have, are they addressing or at least sensitive to a child's trauma? And of course, remaining empathetic, being self-aware, flexible, and able to connect to what that student is going through. These are, again, essentials.
Thank you. Go back to this one. Thank you. Can you guys hear me? Yeah? Okay. So in review, in the last couple of sessions, we've talked about making sure that there is a identification, there's a process for assessing the risk. And so one of the things that Heidi talked about is the liability piece. It's not really to scare anyone, but it's really about what is best for kids, right? What is best for that particular student that is calling out for help. And one of the two of the reasons why school districts get sued is one is leaving the student alone, and then the other is not informing the parents. Those are the top reasons why school districts are liable once they're not identifying that piece for that particular student. We've also talked about making sure that there's effective evidence-based care, trauma-informed, ensuring that like Tina talked about, is it adaptable to the student? Community, is it connected to the community, the culture, language? All of those pieces are really important to make sure that you're connecting to the student, and also providing continuous contact and support to staff. And so, last week there was a question about how do we connect students to resources? And in the meantime, right now, because of distance learning and hybrid learning, there is a little bit of a challenge in regards to getting students connected to services. some agencies have a long wait list. So in the meantime, what are some available resources that are on campus by connecting either to a student consultation team? Is there somebody from that school site that can actually connect with the student? Again, making sure that we're developing confident and caring workforce, right? So training is really important, making sure that everybody feels comfortable in talking about suicide, and also having the ability to make sure that there is a risk assessment. If somebody's new, really coaching them. This is one of the pieces that I did in other school districts when coordinating training for staff or assessors, is that we would have a refresher every single year. If it wasn't myself doing the refresher, having another community organization connect to the assessors. If there was a new employee, I would individually meet with that employee and go through the process of the protocols and practice some of those risk assessments and role playing some of that support for staff. That's really, really important. Again, making sure that you review, practice, and support continuously, and that's really important as well. I think one of the other things that I want to point out also is that when, in relation to supporting the staff, is that a lot of times I used to see administrators, like if there was a school counselor or a school social worker conducting a risk assessment, of course it happened at on Fridays at 2 o'clock. The school shuts down, everybody goes home, and then there's that poor social worker, school counselor left alone on campus with no administrator on site. So it's really, really important that there is that support for the assessors as well as they're conducting, because we know that it can be challenging. It could be a long wait before PET team or PMRT, whatever your behavioral agency calls your psychiatric mobilization team. They may take a really long time to come out and do a further assessment for students. But making sure that you have that support for individuals. And so let's hear from you. We're going to have a little bit of a poll here, and we're going to have you answer the first question. So what changes has your district made to provide trauma-informed care and suicide? We'll give you about a minute to answer this particular poll, and you're just going to write that answer into the chat. I'm sorry, not the chat, but the result here. So good. There's suicide training for all staff. QPR, risk assessments, use of Columbus suicide rating scale. That's fantastic. Code red system put in place. That's nice. That kind of reminds me also that in California, the UC system has a system called the Red Folder Initiative. And so it's really cool if you actually search it, Google Red Folder Initiative, it'll pop up all the different universities, and they have flow charts for each of the teachers or any staff member that comes across, whether students a threat, risk assessment, mental health concerns, and they know who to contact. So it's really nice to see that. Again, suicide toolkit with easy pull forms. That's wonderful, because we know that when there's a risk assessment that's in place, you have to just pull in information that you need. I like that system. That's really neat. All right, so let's go to the next question. Cognito, that's another great training as well. What are some practices you would like to see implemented in the upcoming school year? I would probably vote more distance learning protocols. That's what I'm thinking. I'm guessing. crisis team trainings with tabletop exercises. That's wonderful. Yay, we're going to talk about that at the end. Peer support programs, fantastic. Mental health care student club, that's wonderful. We have seen so much research right now in regards to youth engagement. There is one study that just came out that 40% of students actually want to know how to take care of themselves mentally. And they actually said 27% of students said that training staff is not going to be as effective as if you would train us on how to take care of ourselves. So that's wonderful. The messaging, information, district-wide risk assessment was well processed. That's wonderful. Student support groups, yeah. Full-time social worker or counselors in our small building. We have one district, so the expansion of like support staff, right? Great. In California, there is an assembly bill to decrease the ratio of school social workers student their caseload, and so by hiring more school social workers. So it's still in the works. That's great. Let's go to the third question. And this is particularly related to distance learning. What do trauma-informed practices look like in distance learning? What are some of the ideas that you've taken from last two sessions, or anything that you're connected with in your own school district as well? Somebody recommended the Prepare Crisis curriculum. Any thoughts about trauma-informed practices? CBIT, oh, wonderful. I keep saying wonderful because it is wonderful. CBIT is awesome. Used it for about 12 years now. Social emotional curriculum delivered in distance learning. Community circles. Yes. LA Unified has a really great integration on their website on how to conduct community circles online. Having breakouts for if people need to discuss sensitive things. Yeah, done that before. Psychological first aid for school. Weekly surveys, one-on-one virtual meetings, home visits, and emails to students. Mindfulness. They're all fantastic ideas. Distance learning support, SEL, and focus groups. I think one of the other pieces too to keep in mind as you're integrating or developing some of the distance learning procedures on wellness and suicide prevention policies, ensuring that that you incorporate issues related to equity and accessibility as well. Language is another big one, something to really consider as you're integrating some of the distance learning process or protocols. That's really, really important. Thank you, everybody, for voting and answering. Great idea. Just connecting with students and parents and letting them know you're available, that you're there, right? Sometimes you just need somebody to connect with. And I know in the last session we talked about making sure that there is some kind of a phone line or information about how to access services, and making sure that it's a live number, right? So cell phones or something like that could be something that could be integrated as well. All right, thank you. We're going to close the poll now. I'm going to talk a little bit more about liability here.
Okay, so sorry we had a little bit of a technical delay. So here's where we want to talk about those collaborative approaches. We want different departments to work together. We don't want the silos of, well, these counselors do this type of work and these counselors do this kind of work. The reality is we all serve all our students. And the truth is this is a lot of responsibility and can be very daunting. And the more we clarify, the more supportive, the more effective our screenings will be and our assessments. And so it's really important that different departments who perhaps haven't always worked together because there were specific responsibilities set aside for each person, for each group, that now see that suicide is something that is everyone's responsibility and that they all come together. Also, as we're working on those assessments and we're doing prevention exercises with students, we want to be sure that everyone is trauma-informed in their practices. I know that I've worked with groups who thought it was appropriate just to come out and say, so are you suicidal or not? Do you want to die? Like direct questions like that. So inappropriate. And so our goal was to help us with more effective and appropriate approaches. Because if we know that we have certain colleagues or groups that are not trained appropriately and we can't trust that their techniques are effective and appropriate, then we still have to go in and reassess. That's not good for the student, and again, it's not good for assessing whether the risk is high or not. We want to build that trust with students so that they know who they can go to, that there's a whole wide range of staff who are there to support them. You know, with the video at the beginning, that adult was quite the nightmare for our students, and we all know that students talk, and the students will know if you're feeling something or you're in an abusive situation or you're feeling suicidal, don't go to that adult. And that's not what we want. We want to build each other up. We want to build that collaboration and that trauma-informed practice as a team effort. And then, of course, we have to always remember, and this is where I think many of us helper folks are weak, is we have to remember to help ourselves. We have to do some self-care. And the best way to do that is to remind each other, because I know I won't remind myself, but Tina and Angela will always remind me and force me to do things to take care of myself when it's been a particularly rough week. If you're at Friday and you've done 4 assessments that week, you know, yes, you need a break. You need to do something to take care of yourself, because we're all in for the marathon. This is not a sprint. And so if we don't take care of ourselves, we won't be able to keep moving on that marathon. We might just kind of give up on that race. And so in order to keep being there for our students, let's keep being there for ourselves.
And so as we're thinking about challenges and solutions in relation to collaboration and risk assessment, we have challenges, right? So we have different requirements and no money. I know in California we have a lot of different assembly bills, and then we have no money attached to that, right? So how do we get creative to be able to implement some of these policies within our context for school districts as well? And so as we're thinking about a solution for new requirements and no money, we're thinking about how do we leverage our community partners. We're going to talk about that later on, but it's developing those MOUs, the Memorandum of Understanding, with the connection with the community partners. They already have funding available or attached to the services. How do we connect with them? How do we also connect with law enforcement? As we're developing, we'll talk a little bit about that more specifically, but I'll give you an example. You know, in one of the districts where I worked, as we were implementing the suicide prevention policy, we talked about how do we integrate every community stakeholder. So we train our SROs, right? Our school resource officers were part of the conversation. I also met with the managers from LADMH to review what are the procedures relating to our region, because we know that LA County is super large and they're divided into different service areas. And so we were focusing specifically on our service area. How do we enhance that process? And we met with the managers there to how to create a better process for counselors or social workers when they are conducting a risk assessment. And one of the things that we found is that in talking to the managers is that, when a risk assessment or a call is coming from this district, we know that they've done their due diligence to make sure that this is a high-risk situation. So they were more likely, the responses were quicker for that particular school district that I worked in. And then also, they gave us the back number. It wasn't like the 1-800 that we'd have to call and then, kind of refer that number, and it would take up, it was one time I was at a school site until midnight when the student was, left the school district or the school site. So it's really having those conversations with the community partners and how to really leverage some of the resources as well. We talked about some of the challenges, that frustration, right? Oh my God, this is more work for us, more training. A lot of times I really find that people are just not comfortable in conducting the risk assessment because there's just so much context to it. How do we support staff who are don't feel confident or comfortable in conducting a risk assessment? We're also thinking about the length of a risk assessment, right? Like I mentioned earlier, I was up until midnight at one of the school sites until the ambulance, took the student, right? Again, what is the work that we have to do? Once they get released from the hospital, the post-release, the reentry process, that burnout, right? We do have sites where there are higher levels of risk assessments that are being conducted than others, right? So we need to do, more research and services for that particular school site. The other challenge that we also confront is the leadership changes, right? We talked about making sure the assistant principals or the principals, or there's a process where everybody is, has that information in regards to protocols and support for students as well. And then again, the challenge that we have right now is distance learning, virtual learning platforms, confidentiality, how to, if you're conducting a support group online, having to facilitators be part of the conversation. And I know that, there's lack of staff members available. Somebody mentioned that they only have one district social worker, right? And so how do we have those connections or break those challenges? And again, we're talking about solutions, connecting to safety. This is something that's the most important piece to it. Again, in regards to process, is reviewing. Does the process work? Do we need to increase resources? Somebody talked about it in the chat where they actually want to hire another school counselor or school social worker. Support staff. Do we have to redefine roles? Heidi talked about this already, self-care, right? And again, we know right now we're seeing a ton of surveys, but also in having that survey burnout, but also being mindful of that as well and making sure that there is enough information for staff so that they can give us the information that's working and that's not working as well, so that we can prevent that burnout for our mental health staff.
So given that this segment is about collaboration, we thought it would be beneficial to share some information and research around the actual term collaboration. It's just not a term that sounds great and gets everyone working together. There's actually some true dynamics behind effective practices. One of the issues with challenges that Angela mentioned was budgets, and the more collaborative departments and agencies are with each other within, as well as within the community, you need less budgets per se to be more effective. As you can see here with the service delivery continuum, the highest level of collaboration is actually partnerships, and that's when fiscal resources are actually shared. But then you can see then it's about collaboration and then facilitation, coordination. It goes all the way down to just considering, right? And you have to ask yourself at different places and different times, at what level are we truly working together? Are we just really cooperating, or are we taking risks and collaborating and putting ourselves on the line to support each other? When we're at consideration and cooperation, then our services are cost intensive. we end up exhausted, our program resources end up exhausted, and also lots of program duplication. And of course, ultimately, this minimizes our effectiveness. The higher level up the continuum we are working, the fewer students fall through the cracks, the fewer repetitive or duplicate services are applied, it's more fiscally efficient, and ultimately we're maximizing services and resources. We're serving more for less, we're serving more with less effort, and we're serving more effectively. And so we just wanted to share what this continuum looks like. Another way of looking at it be this collaboration continuum. You can see that when you are in the direction of collaborate, integrate, this is about trust. And when you have that high level of trust, you have longer interaction, you have integrated missions, you have shared goals, shared decisions, and of course, ultimately shared resources. And that's what creates sustainable change. So going back to Angela's example of leadership challenges, if you have a program where your leadership at the school, like the principal, is cooperative or coordinates with you, but they haven't truly integrated the system or the program you're implementing, then what happens as soon as that person is transferred to another school, and we all know that happens, right, every 2 to 3 years, then the system that you've just implemented is very vulnerable to be cut or just to be forgotten. And so it's important to reach that higher level of collaboration and integration so that everyone has true buy-in, and when new folks come on board, they get that this is something they have to step up to, and you don't lose that program's viability or fidelity. Another way of looking at it is if you look at the arrows below, are we disconnected? Are we losing time and resources? That's because we're in competitive mode. Are departments competing against each other? Maybe we're not competitive, but we're just coexisting, but we're not really working together. And so different departments have different hours, different specialties, different coverage levels. And so why are we not working together to ensure that the full continuum is covered and we can be more effective? And that's where it's about being structured and coordinated, which again ultimately leads to more sustainable practices. And then we don't have to recreate the wheel over and over again. We just sustain the wheel, which of course takes much less effort. Again, you can see we have turf on the left, trust on the right, and I had talked about that just a second ago. I did want to take a second to clarify a question that came up. Someone was asking in reference to what I said, is it okay to directly ask students if they are feeling suicidal or want to kill themselves? And yes, when you are completing a full assessment and you have built rapport and you've done your check-in and you have a trauma-informed approach, it is appropriate and necessary to be direct in that way. My reference was more of just somebody walking into the room and kind of yelling at the students, so are you going to do it or not? Are you suicidal or not? Because I don't have a lot of time to talk about this. I was referring more to that very aggressive, non-trauma informed approach. So thank you for clarifying that and giving me the chance to mention the difference. Thank you.
Point in regards to your tone in regards to asking that question, it's going to be very different if you ask somebody, are you thinking about suicide or are you thinking about suicide, right? So it's a different context. And again, it's about invitations. You want to be able to set the stage for the student to be able to feel comfortable in having that conversation with you. The reason why we want to say it is because it also validates what they're feeling, right? Oh, you know about suicide, so I feel comfortable talking to you about it. There's no shame behind it. There's no secrecy. So it's really about having the conversation with them. So it's really important to make sure that you're inviting them to have this conversation with you. And so these are the benefits of having a collaborative approach when it comes to risk assessment. So one, Heidi talked about this already, where we're tearing down the silos between support personnel, like, oh, I can't do it, or I'm too busy, or it's really about having that collaborative approach. In both of the school districts that I worked in, the integration was very important for the assessor to have to do a consultation with someone else as they're conducting the risk assessment. If they couldn't find another person, I would be the one that they would contact for a consultation for the final kind of assessment of the risk. And again, making sure that there is an enhanced communication in regards to treatment, validating the resources and the support for the student. And Heidi talked about this as well, is that you're reducing the risk. And so, in the example that I gave in one of the school districts that I worked in, is that we were reducing the frequency of the crisis because we really looked at our data to make sure, do we need to do additional training? Do we need to do prevention work for our students or teachers? And then also we were eliminating unnecessary conversations with students. Sometimes they would be, 55, 85, 51, 50, and it was an unnecessary hospitalization. So it's really about having the competition, collaborating with each other as support personnel, and having somebody that's clinically available for that individual to be able to consult and debrief. Sometimes, a lot of these can be very traumatic for the assessors as well. I would have my own, individuals to debrief with. Sometimes I would call Tina or Heidi and have conversations about, the multiple risk assessments that I conducted within that particular week or day. Again, leveraging the community partnerships, making sure that there is an integration of additional stakeholders to be able to create the policy that you have in place. Again, having conversations with your emergency department, your behavioral health department, and also making sure that the County Office of Education, having contact with them as well to see that there is some additional partnership training opportunities to be able to build capacity. And we'll talk more about that when it comes to developing a crisis response team. Again, the last piece is the emergency department. In the previous school district that I worked in, I was part of the coalition for one of the hospitals to just to create a partnership in regards to who do students contact when they are released after hospital. There was a handout that was given to that particular student. I know every school district has a different process and procedure, but it's at least having those conversations with the individual emergency room departments to be able to have those connections, have those resources available, so that, especially right now, there was one situation where at the beginning of the school closure, there was a student that had a really hard time enrolling in school because there was no offices that were open. And so during that time, we were able to troubleshoot that situation because that student was released, and they were able to contact myself so that I can, provide some additional resources while the student was being enrolled into the school site. So it's really important to make sure that you have those connections with everybody. And again, we want you to keep in mind that this process takes time. And we'll talk about a plan later on, but it takes time to be able to develop, these particular, resources as well. And so in the next piece, these are some of the pieces that partners can do. These are some of the benefits that as well. So these are some of the benefits that a partner can provide, right? So linkages to services. And again, that friendly handoff, right, that you're providing for that student, the direct contact during the school closures, like right when it first started, we had a community alliance meeting, which is all of our providers within our area. And we had a conversation about referring families and students. It's really developing that cohesion with your partners and have those conversations in regards to like referral processes and different things of that nature. Having that direct linkage, we would actually have a direct phone number for those individuals, for those partners as well. And then if there is, like I mentioned earlier, if there is a wait list or insurance issues, those kinds of things, having the conversation within the school to find out if there's somebody that can actually connect with the student, refer them to an SST or an SCT, depending on what they're called at your school site, so that that student can receive ongoing support as well. Within your intervention, the partners can actually help with the assessment. They're not going to do the assessment, they can support with the assessment. Safety planning, again, linkaging to services. You're going to be able to get releases of information right away so that you know that the student's going to be connected to an on-site. If your behavioral health community partners are on site, you can do a direct referral. They can actually help with, supporting with home visits. We had some resources available for transportation. I know that in our, depending on how you leverage your funding, if students needed to get a bus pass or different things of that nature to be able to connect to a site, because they require specialized type of support or therapy, then we would provide a bus pass for that particular student. I know right now that it's a little bit different because of the pandemic. So again, having that conversation with your partners and your postvention as well, they can be part of that collaborative process when we're talking about the behavioral mental health support, the emergency room department as well. And then also making sure that there is that reentry process that takes place so they can do that piece. And we're going to talk about this at the end, and when in relation to crisis response, building the crisis response team, they can also be part of that conversation as well. So it's really important to make sure that you leverage your community partners to be able to provide this support in each other level.
Okay. I know it might be a little bit tough to read this, so I wanted to share with you some of the points because you've seen some of the national data, which are the first couple of points, and we talked about that quite a bit. We wanted to share just a couple of things that have been observed by our local Children's Hospital of Orange County in regards to hospitalization as a result of suicidal ideation. And what we are seeing is increased distress within 30 days post-hospitalization reported by students and parents. Increased distress. We also see that there's little support or accommodation, and this is data from real time. This is during COVID, during the pandemic. One thing that we found really interesting is that there is an increase seen in suicide attempts needing medical care. We're not just talking about ideation here. We're talking about actual attempts and intervention that requires medical attention. We also have seen an increase in severe psychological distress as reported by parents. The parents are aware of it as well. And so we're going to talk a little bit about how to support and essentially arm them with tools again. Another point I want to make is that higher acuity in calls for child abuse, right? And though we see or are hearing less calls for things like DV or child abuse, we know that things are happening, right? We absolutely do see that what we see is incidents continuing or escalating, but reports actually decreasing. So just something to keep in mind. On the school-based level or school district level, what we are seeing is a couple of things in this virtual world, and my hope is that some of the things we'll share with you addresses distance learning and these issues. We are seeing a delay in reporting, meaning something has happened during the school day, during instruction over distance learning or hybrid learning, and it's not reported until the end of the day, which grossly reduces the amount of support that can be provided or contact with student and family. And so risk goes up. We are seeing increase in email notification because it's a virtual world. And so we are seeing an increase in regards to suicide. We're trying to remind folks that, again, no email notification. It must happen now, whether that means over the phone or intervention called to the home face-to-face. Uncertainty of process, protocol, and resources. I think one of the biggest things that will fall throughout this section is just reminding, as we talk about self-care and staff burnout and things, is that we too are experiencing this pandemic. And so even though we know that there are existing protocols and procedures that depending on where we are at and depending what's happening, the uncertainty is there. You could give out a handout, but you have to repeat it a couple of times because we are all impacted. And so just something to clarify. And also just make those protocols as simple as possible. As we move forward, and again, you will get this presentation, so you'll have a closer look to the actual forms that I'm sharing. But one of the things that I do want to share with you is a sample of the reentry process. And this is actually information that has been shared with administrators within a previous district. One of the things we want to do is essentially explain or define what reentry is. On this call, we know that you're very familiar with what reentry is, but for administrators, we might, and for staff on or at sites, we may have to clarify that it's not necessarily the transition from a juvenile institution or an alternative education program, that we're talking specifically about post-hospitalization mental health related reentry, right? So it is the reentry regarding or after a hospitalization due to suicide attempt or ideation. The description of it, just breaking it down further, is that it can be district or a school-based meeting. So a reentry in and of itself is assembling that meeting, right? And it can include, must include student, parent, school personnel, and we'll kind of go through all of those pieces and what their roles can be, from administrator to social worker, even nurse or counselor. And then we go into what are the responsibilities? What has to happen during this process, which is the third column right there in the middle. First thing that has to happen is that we do need administrators on board to mandate attendance and coordinate the attendance of members, right? The administrator will schedule a mental health reentry planning meeting. Parents, we ask that they sign necessary consent to release information. This is at minimum, right? We want them to be active partners and stakeholders within this meeting. We want to ensure that the third bullet there is notifying and updating appropriate school personnel regarding release plans. And that's either to be a part of this meeting or to be a part of the team that follows up after. We want to make sure that whether it's student services, you might be calling it pupil support services, but essentially that there's a designee, especially at the district, who can attend this meeting, that can support. Maybe there are additional resources that are available that are not made aware to this particular school at that moment. So really increasing that communication between school site and district is going to be critical, right? And if site is contacted directly by the hospital, and this happens, if you're able to have that partnership where the hospital calls the site directly, it is still important to include additional support. I guess what we want to impress upon you is that collaboration is needed for all of these steps, that it's not all just on one person. Finally, the plan. So if you move toward that fourth column, the plan essentially is once folks are assembled, you have parents provide hospital discharge paperwork. Can you mandate that? No, not necessarily, but do you explain to parents how important it is and how it will support the students in their progress so that we are all on the same page? Absolutely. You know, when Angela was talking about prevention, intervention, and postvention partnership, wouldn't it be wonderful if, as part of the prevention and when it's quote-unquote quiet, that we are actually able to have the hospitals, and this is possible, we have great partners here, to actually have access to our forms, our release, consent to release information forms, so that there is no break in the communication. Once those are signed, we know that we can talk freely between each other and be able to, again, get history of what hospitalization has been like, progress, and what are the needs upon discharge. Aside from that, we've talked about releases, support plan, I'm going to go into greater detail, but identifying resources, support systems, even talking about medication, and talking about what are accessible resources, what are barriers to getting those resources to the family, and of course identifying safe folks at the school site. What I want to go into, and just kind of as a snapshot, are essentially the 6 roles that can be played during a reentry, right, from administrator, other staff, other community partner, mental health lead, student, and parent or guardian. So as we dive in, your mental health lead, while you are not necessarily making the calls and scheduling the meeting, you are constantly communicating with the administrator, who again is mandating that this meeting happens. We ask you to be that mental health designated lead of the meeting, okay? So this is the person who has the most familiarity with the actual form, knows what to ask, what nuances to look for, They are constantly triaging and assessing. And examples of those folks have typically been social worker, coordinator, school psychologists, school counselors. They will provide information regarding student disposition. They are typically the ones who have that direct connection to the hospital. And so hospital is communicating with them, release forms are worked through or provided through, facilitated through this particular person. They provide recommendations for accommodations, and they ensure that that reentry form is completed. The administrator is a little bit different. Again, mandating, they are mandating it happens. They are the school leader. They are providing recommendations, but we need their go-ahead because, again, if we don't have support from the top, it's going to be very difficult to ask other support team members to agree to these accommodations, right, or even be informed. So they're going to be critical, and they work hand in hand again with that mental health lead. Other folks, parents or guardians, we want to make sure that they provide the discharge paperwork, sign those release forms. If there's additional history that we're not yet aware of, we want to make sure that they're available. We want to talk about if the child has already been discharged, let's say we've missed that window to have that discharge meeting or connection with the hospital, and let's say student is already at home, how has their progress been? How have they adjusted? And so those are the questions that we'll ask of the parent. They, of course, may provide some requests or recommendations that they feel need to happen for their student, and they'll support everyone in this process. We hope will support the recommendations determined at the end of the meeting. Student is as appropriate. There are times and there are parts of the discussion that will not be appropriate for a student to hear. And then we also want to consider developmentally what is okay for that particular child to hear. Are we talking about, for example, a fourth grader, or are we talking about an 18-year-old, right, or a 17-year-old? Other support staff, absolutely. I think that there is a caution about having too many team members in a reentry meeting. I will tell you that as long as they have a designated role, numbers are welcome. We want to make sure that information is protected, and student, of course, is supported. But they essentially act as a contributor to the reentry meeting, right? It could be others who are not the mental health lead, and we have a list of folks there. They act as a student advocate, oftentimes, again, sharing information that maybe not all of the leads are aware of. They might have additional recommendations. I even think about team members who are providing restorative practices, who are providing after-school support, that have a close connection to a student and are, again, able to provide information that maybe hasn't been shared before. Other community partners, we want to make sure that they are invited. This might mean if there's already been a linkage to, let's say, wraparound services in the community, we invite those folks, parent partners, case managers, county social worker, or community-based therapist. Allow them to act as a student advocate as well. And this helps to coordinate the services at the school site level as well as in the community or in the home. So those are essentially the roles of individuals. And again, you will be able to see this in greater detail as far as the form goes. But essentially, what I want you to see is when you create your own forms, at the top, absolutely demographics are going to be important. But I urge you to put everything on there from whether or not an IEP exists, whether or not a 504 exists. I also put room in there for completed safety plan as well as the date. We know that through this process that there may have been a safety plan prior to a student being hospitalized, and then another one at the hospital, and another one upon discharge. We want to make sure we have the most updated safety plan. Will that one be used here in the reentry, or do we need to make adjustments to it? Also, in identifying IEP and 504, we're also going to be able to see, are there additional supporters at the school site level that we need to bring in? So that's really going to be important. Aside from that, you should see towards the middle there medications. And we're not just asking what, we're asking how much and what has been the change. We all know that with particular medications, a little bit of change in dosage or frequency can absolutely have an impact on a student's health and mental health. And so we want to track those changes if at all possible. Aside from that, you're going to see on there, we want to list the participants, their contact information, and what the relationship is. Any potential concerns at the school, right? Even in the virtual learning environment, you may have a student who identifies that being synchronous learning and in a distance learning environment and seeing all those squares is a little too overwhelming. And so is there a need to make an accommodation? And so those are the kinds of things you want to make sure you list on this particular form. Okay. And what are the ideas? Sometimes we think that a smaller classroom might work out. We've had students move from a 32 plus classroom to an 8-person classroom, and even still, that was too overwhelming. So what other models of instruction can we turn to? And our second page looks more like other services. I mentioned folks who do restorative practices or after school a little bit earlier. Are those folks we need to name here too as safe people, right? And what is their contact information? And my caution is that anybody that you list, right, on this reentry plan, that you contact them and you let them know that they've been named, right, on this plan. Finally, the last kind of table there really identifies outside providers. Okay, so it doesn't just ask for their contact information, it asks for status, because we all know that though a referral has been given, has it been completed? Has that student and family made it to the first appointment? If it's still in progress, you got to put that under a status. And we got to check in to see, you know, what are those barriers to actually making it to that call or to that office. We actually here have chosen to list on there the first follow-up meeting date and the second. This is at minimum. We just want to make sure that at minimum there's 2 follow-ups within a 30-day period, because we know that to be the most vulnerable time for a student post-hospitalization. And of course, signature of commitments here that they are part of the plan. That's for all parties present, so that we all can agree that we have understanding of what needs to happen next. So that's essentially the reentry process, right? And I just want to make sure I haven't missed anything as far as like questions, but I'll review the chat. But I guess what I want to say is, if it looks formalized, we have formalized the process. And we encourage folks to do that as well within their district, to make sure that we are all aware, again, that we do have to be a part of that continuum of support from the moment that student steps out of that hospital. So, thank you.
That this reentry plan can also occur via virtual as well. And so it's really important to make sure that, you know, the conversations still happen even though we're in this virtual environment. And then also, these are great conversations to have, is what additional support services does this individual need? And so in the interim, I know that there's a lot of, there could be a lag time between the students getting that access to services, or they may require additional support, whether it's because it's got their mental health issues have escalated. There might be somebody within the context of the support plan that can actually do weekly check-ins until that individual is actually connected to resources through the outside support. And I know that a lot of agencies right now are providing that virtual teletherapy as well. So, you know, having the context of having a wraparound support, like somebody was mentioning in the chat, is making sure that there's a connection, but also making sure, because the parents are the ones that are, you know, keeping an eye out on the kids right now more consistently. So having that connection with the parents as well. I know that there was in one of the agencies where, in one of the previous districts where I worked, there was an agency that did a in-home. I know that right now it's hard to do in-home type of support, but there were several individuals that would contact the parents to make sure that they were following up with the safety plan for the student, making sure that there was that means restriction, keeping that safe, the constant check. And then also, a lot of these plans can also be done online. There is My 3 app is a free safety plan app that students can actually download as well. So there's a lot of different varieties that you can do in order to integrate some of these pieces in distance learning. And as you're thinking about, we're going to, just have a conversation in your mind in regards to thinking about what partnerships you need to enhance to support all of the areas in your reentry plan. As we mentioned, there's different providers. There's the community agencies. How can they actually support your students during distance learning opportunities, and then also making sure that there is that support for individuals during this time. So as we're moving forward from the reentry plan, and if there are we're looking at postvention considerations at this point, and there might be situations where students die by suicide, and so how do we provide that support for additional for students that are survivors, and the parents as well. Suicide is a very complicated place to understand. There's a whole context that happens for an individual to die by suicide. So we know that there's risks for prior history, family history of suicide, access to legal means. So there's different contexts that we are thinking about when it comes to suicide or somebody dying by suicide. Tina talked about the statistics already. We know that they're alarming. We are going to give you guys information about where to get the current statistics, but we know that they're alarming, right? We know that there's a process that we need to provide to support students within the context of suicide. So what do we know about the impact of suicide loss? We know that it's very traumatic and it can actually impact up to 7 generations. So if somebody in the family dies by suicide, it can impact that family up to 7 generations. So we know that there is a traumatic component to it. So we know those pieces as well. It has a huge impact on the community. And then depending also, especially now within the context of media, other individuals are also exposed to that as well. In one of the previous districts that I worked in, there was a very high-profile suicide that occurred, and it was in the news, in the national headlines. And so those are additional pieces that are impacted, that individuals are impacted as a result of those pieces. So why do we consider postvention in schools besides having that piece within the policy? Part of the reason is because kids spend most of their time in school. You know that right now they're spending a lot of time at home, but it's really about providing that support so that we can reduce the suicide contagion. And that's the other reason why it's important to have the process in place for postvention services for students. So when we're thinking about goals of suicide prevention, one of the pieces, Heidi talked about this before, our duty to protect and support the environment, but it's also about preventing the next suicide. We know that there is 5% of the suicides that occur are contagion factors, right? So they kind of run in clusters. We want to make sure that we're supporting the survivors in the process of grief, right? Identifying individuals who are at risk for suicide, that's really important as well. And then also, again, minimizing the risk of suicide contagion and providing that support for additional individuals. And then also, we want to make sure that we're helping the individuals return to their new normal as much as possible. Yeah, I talked a little bit about this in regards to contagion can lead to clusters of suicide. We know, again, like I said, there's about 5% of the contagion are clusters of suicide, and really want to make sure that we're providing the support to students. And I talked a little bit about this earlier, where media coverage should not, focusing not specifically on that suicide, but really supporting the individuals of the grief that they're experiencing at the moment as well. And again, we know when it comes to contagion, we're looking at we're going to talk about memorials. We're going to talk about some of those pieces, but it's important to make sure that we're providing that support for individuals as if somebody dies by suicide within their community.
You know, unfortunately, there are times where we do encounter or we do have to be a part of coordinating memorials. And so we just wanted to make sure that we give a little bit of guidance as far as what memorials can look like. In regards to suicide, we know that we are not glorifying what has happened. We want to make sure that we honor the life of that particular person. And in general, we want to make sure that there is a pre- and post-funeral response. The idea behind that is that initially the shock of what has happened is something, and the reaction to the death, that will in fact require support, right? We want to make sure that we have a crisis team available, that we do have support, maybe the school social workers, school counselors, whoever it is that's your mental health team, that they're available to provide that support. What we do see is as we get closer to the funeral, we see a resurgence of those same emotions or the reactions coming back up again, though those students have been provided support and there's been some sort of stabilization as well. We want to just, again, be ready for post-funeral response. And it may look very similar to what you've done before, but two different events for the same incident or same death. As far as memorials go, we want to make sure that we are aware of anniversaries. We want to make sure that whether it's not just the anniversary of a child's death, but maybe something significant in their history or in their childhood, we want to make sure we are aware of that. And we're going to get that from, of course, their peers or their family members. As far as sweatshirts and T-shirts, we wanted to just make a point of putting that there and say that there are times where we are put in the position of, and I can recall this, and maybe I believe my team members here as well, where we've been put in the position to have that discussion with students, well-meaning, well-intentioned, who want to honor their friend that has died, right? But really putting guidelines around the sweatshirts or T-shirts with their names and the dates of that child's life and death. Reason being is that when we have provided support, and again, the students and the school site have been stabilized, maybe in the month of December, wearing that shirt again come January or February could absolutely re-traumatize or trigger or cause an emotional reaction, right? Needing additional support for another student. So we want to think about the re-traumatization factor always. And this might also apply to the retelling of or the discussions that we have around the death of a student. So just really being conscious of that. As far as other things, you know, from car wash to letter writing to action projects, even in the virtual space, there's been discussion of virtual memorials, right? Or creating a space where students can tell their story, their positive story about that person's life. All of those things are positive. What we're trying to get you to see is directing the energy. There's an energy there. There's a need to absolutely observe that student or honor that student's life. And we want to make sure we help think about and plan an appropriate memorial. We want to make sure that that memorial is, and we use the term containment, again, containment or stabilization of that site. We look to what is the purpose of the school site. It is a safe place, and we want to return it to a safe place. There have been times we have students say during a crisis response that I don't want to go into the library, and when asked why, they say because the student's picture is projected on the screen. We are very much asking that that not be the case, and that we keep the sites at the school safe of that kind of, again, re-traumatization. We want to absolutely support the continuation of the life cycle. And so if you are choosing to do something that is more permanent as opposed to a temporary memorial, right, one that has a timeline, if you go more towards permanent, we ask that folks consider a symbol to support the life cycle. And that could range from, usually it ranges something like planting a tree or a rose bush or some sort of, again, positive symbol that continues to grow through the course. And one of the other cautions I just want to say in regards to memorial is that what you do for one student has its ripple effect and its impact. We ask folks to think generationally, meaning what you do now may impact students, for example, at the high school 4 years from now and another 4 years, right? So we want to consider that. Also, we want to think about the spirit of equity, spirit of equality. We want to make sure that what's done for one student is done for all. Some of the responses that we've seen have become more complicated or even have turned against administration because we've seen what was done for one student who had died 3 months ago had not been done for another student. And then you have hurt individuals who want to just, again, honor their friend. So really just think about what precedent you have and thinking, again, generationally about memorials.
And so as we're looking at the suicide prevention pieces, we want to make sure that we are keeping an eye out for those individuals that are affected by suicide, right? So we're thinking about those who are close to the situation, some of the risk factors, information about, past individuals that have had some risk assessment or some kind of referral that's been done to the school. So it's just really keeping an eye out for those particular individuals as well. And then also making sure that there is that the context of controlling the media, right? So when we're doing our crisis response within the school classrooms, we always talk to kids about making sure that they respect the life of the student and also respect the family, and then control the rumors when it comes to information. So it's really making sure that you're getting permission from the family as well to divulge, information out as well. So I think it's really important to make sure that you're identify individuals who have been affected by the suicide. So as you're thinking about crisis, so thinking about if there's a crisis that would occur today, I'm going to knock on wood, will your school and community be ready to respond to the emotional needs of those impacted? One of the things that when Tina was mentioning about the memorial is also keeping in mind that it does take a village to be able to support everyone after there's an impact or there's a death by suicide. It could be a student or a teacher or somebody within the community as well. And so it's really important to make sure that you have all your resources in place if there is a crisis that does occur during the moment. That particular incident that I talked about, it went for about a couple of weeks support because it was a very high profile type of situation, and we wanted to keep the information in-house. But we also made sure that there was a containment. Everybody meant well. Everybody was emailing from the community, what can we do to support? So we gave the counselors, the school social workers, the nurses information about what to say. So there was an actual disclosure of information, and it would only they would only contact one individual. So just keep it in mind, if there's a crisis that would occur today, would your school district be ready for the response?
So as far as the plan goes, just wanted to share that creating the crisis response team, there's different phases to this, and so essentially if you're doing it, you want to develop that plan. What do you want it to look like? And the next slide will look at the 3-year plan that you essentially can put together. These days it does have to include media and social media policies, or at least procedures. With your second phase is really thinking about who's going to be a part of the team. We talked about earlier breaking down silos, right? So who will those team members be? What will their roles be? And do we need to include backup support? Essentially, backup support can look like community-based organization or county of education, county office of education. Phase 3 would look at training. Once you've decided upon a standardized way of providing or a model of providing crisis response, now it's time to train out to admin, crisis responders, staff, and students. And finally, phase 4 is, you have been responding up to this point. Now that you have implemented, you've been trained, and now you're implementing the models, how is it working? Looking at what needs to change, what procedures or protocol have to be more refined, and constantly training is going to be critical as far as testing and doing those mock table topics, which I know other folks on the chat had shared earlier as well. So this is an example of, sorry, Angela, this is an example of this particular plan does actually combine both the crisis response and threat assessment models, and you have pioneers and Angela and Heidi here as well who put these frameworks together. But essentially, again, year 1 looks at training and establishing those pieces. Year 2, expanding it, including others, having all of the protocol, including additional training for threat. Again, think phases. And again, year 3 is going to be refining the process and making sure that we're now learning from what has happened, sharing best practices, as well as identifying red flags and training that out. So, yeah.
And when it comes to looking at trainings, I think the other piece too is making a decision in regards to what type of model you're going to use, whether it's the PREPARE model, FISM, PFA. There's a lot of different evidence-based practices that are out there, so it's really making a decision in regards to what type of training is going to happen, and then also what the cost is. And so that's another piece that we're looking at. So within the context of training, you want to make sure that there's executive leadership is trained in regards to the protocols, specifically the superintendent's office, as well as the public information office as well. Administrators need to be trained on their role within the context of crisis response. Also, your eyes and ears, your teachers, your staff, what happens when there's a crisis, there's a risk assessment or a threat assessment, who do you contact? Kind of like somebody talked about the red button or the red folder initiative. Those are the kind of pieces that you want to make sure that you're implementing. And then also responder training, right? So you have your assessor trainings for risk assessment, and then you have your responders for the crisis response if there's a death by suicide in the community as well. And then also your incident leader trainings. These are the individuals that provide that direct organization of what that crisis response is going to look like. Just making sure that you do that. So one of the pieces about crisis response is that we're looking at a context of different pieces. One of the pieces that we look at is suicide is considered a crisis, and then this is a list of different issues that can actually occur within the context of crisis. In relation to school, right, a school crisis is something that's impacting that particular school site directly, and it affects, it could be a short term, it could be a long term, and it also creates a lot of shock, confusion, and fear. We know that everybody responds to traumatic situations differently, so it's making sure that everybody has that support available if there's a crisis that occurs within a school setting as well. So what we're looking at the goals of crisis response is the natural piece is that we want to make sure that we help everybody return back to their new normal, and create that natural resiliency, the wellness, supporting, identifying individuals that need additional support. And then again, stabilizing the situation. We want to reduce symptoms from escalating. That's really, really important. And again, we talked about the adaptive functioning, making sure that, everybody, like I said, it responds to crisis in a different way. It impacts everybody differently. You can have cognitive impact, behavioral, etc. And so it's making sure that we're providing the support for those additional individuals that are impacted as well. And then also, again, making sure that there's a connection. How do we, whoever's impacted, how do we connect them back to resources or to the site or back to their, natural environment of learning, and making sure that that is available for the particular individuals that are impacted. And again, the district really has to understand the aware of impact and crisis on the learning of students. So as we're looking at crisis response, these are some of the pieces, the benefits of providing crisis response. It decreased absenteeism because we're actually connecting. There's research connected to that, that the closer that you are to supporting that individual that's been impacted, the higher the functioning, they're able to cope much more faster, and also being able to deal with some of the situations as well. And then also, if you're providing support to your staff, there's also that evidence or research that illustrates that there is that ability for them to cope much faster if there is a response that happens right away. And so as you're looking at, this is just a sample chart of a crisis response mobilization that we're looking at here. And so it's important to make sure that this particular piece is customizable or adaptable to the district process, making sure that there is however the crisis is directed to, or how is it identified, if it's somebody from the community, who do you contact to be able to initiate a response? And then you have a procedure in place to make sure that it gets to the incident leader, whoever your crisis response coordinator is at the site, and actually they can actually begin to coordinate the response as soon as possible. And that particular immediate, this is not related to suicide, but one of the districts that I worked in, we coordinated the Kobe Bryant death. And so within a couple of hours, we already had a team in place when we found out the information in the news. And so it's really important to make sure that you have immediate access to the process, the mobilization piece, the responders being available to provide that support. And again, if you don't have enough responders, this is where your community partners can actually come in and provide that additional support for mobilization.
Okay, so here we are, our third session, ready to wrap this up. And just a reminder as we look at this graphic of why we are here. Whether we're mental health providers or school district folks, we all work for an institution of learning. And the focus and the goal of this institution is always to increase that capacity of learning and to develop our students in all of their, important reading and math skills and all those skills needed to be successful in their future. As support staff, we know that it's critical that their focus is clear, that they're mindful of their work, and that they're not worried about ideations they may be experiencing or threats or any of those other items. And that's why we've put this seminar together, so that we could bring you all new information and examples of things that we have all experienced in different districts and different places to help us come together. The number one outcome in a district is learning, but that outcome will not increase if support services do not increase. Our students need our support more than they ever have, and I feel like our professional community is stepping up more than we ever have. And together we will meet this need, and we will support our students to their optimal success. It's been wonderful having you all here. Thank you so much. It's been a thrill for us to support you. Good luck out there.